Hi, good morning, everybody. Please join us in the room. First, we start with a short video. As yesterday, we had a discussion and Hannah from Lebanon told us how successful she has done a walk last year. So now please make a video that everybody can see it in real, how it was looking. This is Hannah. Hannah, say hello to everybody. It is your video, 2-minute video. Yeah?
Everybody's getting their cold showers this morning? Yes. Anybody have hot work? Yeah. Yours was hot? No.
Hello, good morning once again. Now we start the session. Please, can I ask to come to us Mondel Latif from What Patient Safety, he will talk about What Patient Safety Day Action Plan, and Sue Sheridan. Other people, Helen Haskell, Karsten Engel, and Regina Namata-Kamoga, they will share a video with us. Thank you. Please have a seat. Our first presentation will be from Mondel Latif. He is a regional advisor of World Health Organization and at the Department of Universal Health Coverage Health System. He is responsible for Healthcare Quality and Safety Program at the Eastern Mediterranean Regional Office of the World Health Organization. Dr. Mondel is Professor of Preventive Medicine at the University Hospital of Monastir, Tunisia. Dr. Latif areas of expertise cover health system development, quality, and patient safety improvement, as well as preventive medicine and public health. Dr. Mondel Latif is member of the International Academy of Quality and Safety, the Middle East and North Africa Health Policy Forum. So, in front of us, Dr. Mondel Latif, please take a floor.
Thank you, Mrs. Chair. Good morning to everyone. It's my honor to be with you today and to walk you through this, my presentation, which is about the WHO Global Action on Patient Safety. So during this presentation, we will cover some background and context issues, the global movement of patient safety, an overview of the Global Patient Safety Action Plan 2021-2030, the role of WHO in advancing the patient safety agenda, the upscaling action, what needs to be there in order to successfully implement the recommendation of the Global Action Plan, and some take-home messages. So, as you know, patient safety is an important priority that faces health systems everywhere, regardless of income status. It's critical to achieving universal health coverage. And yesterday we have been talking about universal health coverage. And believe me, the universal health coverage will not happen unless quality is embedded in it. Because simply, if you are not delivering quality and safe care services, people will not use your services. It aims at avoiding harm to people for whom the care is intended. And of course, it underpins the principle of first do no harm. And it's one of the most important components of healthcare delivery. It's the entry point to ensuring quality in the broader term. It's particularly very important in low and middle income countries, and especially in fragile, conflict-affected, and vulnerable settings. Over 1 in 10 patients continue to be harmed from safety lapses during receiving healthcare, and globally, and safe care results in well over 3 million deaths each year. Recent estimates suggest that as many as 4 in 100 people die from unsafe care in low and middle income countries. The burden of harm is estimated at 64 million disability-adjusted life years, similar to that of HIV/AIDS. And very important to note that the adverse events, the medical errors, are highly preventable. Just for you to know that we conducted a study in the Eastern Mediterranean region, and we have found that almost 80% of adverse events are highly preventable. So this is a priority, and with an investment in patient safety that offers good returns. The global movement started since 2004 through the World Alliance for Patient Safety. And from that time, we launched several challenges, several programs, such as, for example, the Clean Care, Safer Care, the Safe Surgery, Save Lives, the Patient Safety Curriculum, the Patient for Patient Safety initiative, and many other tools and initiatives. In 2015 till 2020, we have the Global Patient Safety Network, and the WHO flagship was established. Following that, we had several ministerial summits for patient safety. And in 2019, we had the resolution from the World Health Assembly, which is the resolution 72.6, that asks for developing a global action plan for patient safety. And since then, since that time, we have the World Patient Safety Day, which is being celebrated the 17th of September each year. So here we have the global, the ministerial summits that started in 2016 in London, then it was followed by Berlin, and then Tokyo, and in 2019 in Saudi Arabia. In 2023, it was stopped during to COVID, but this year, the next year, and 2023, it will be celebrated in Montreux, in Switzerland. So all these events, the ministerial summits, have paved the way forward for the endorsement by member states for the resolution 72.6 that calls for the development of the Global Action on Patient Safety Day with a series of a number of recommendations in order to promote the patient safety globally. What's in it? The Global Patient Safety Action Plan. We have a vision, we have the partners, the governments, we have the mission, the goals, we have the different strategies, and also the strategic objectives as well. So the mission, the vision is a world in which no one is harmed in healthcare and every patient receives safe and respectful care every time, everywhere. The mission is to drive forward policies and actions based on science, system design, and partnerships to eliminate all sources of avoidable risks and harm to patients and health workers. And the goal is to achieve the maximum possible reduction in avoidable harm due to unsafe healthcare globally. The partners in actions are governments, the stakeholders, different stakeholders, the healthcare facilities and services, and the WHO Secretariat. So stakeholders in general, including, of course, the public, the communities, and the NGOs. The strategic objectives are 7. We have the policies to eliminate avoidable harm in healthcare, the high reliability systems, the safety of clinical processes, the patient and family engagement, the health workers' education, skills and safety, information and research and risk management, and synergy, partnership, and solidarity. Of course, these 7 strategic objectives, for each one of them we have strategies, and in total we have a framework that includes 7 by 5 interventions and strategies. And you can imagine that this is, for a country, it needs some work in order to start with the most relevant and the most important and urgent ones, and then you can build from these priorities in order to cover the remaining ones. It's very comprehensive, and it includes almost everything that relates to patient safety. So the implementation is key, because most of the time we develop a framework, we develop a policy, an action plan, but when it comes to the implementation, things will not move smoothly. So we need to involve the government at the different levels, and this is the upstream in terms of policy, execution, in terms of prioritization, action plan, adaptation, leadership, buy-in, and landscape assessment. Most of the time, when we have a good idea, we know the evidence, this is something that will work without any problem. But when we go to the field, we will feel like shocked, because things will not move as planned. So you need to gain the commitment and the buy-in from the leadership at the different levels, so that they can support you for the implementation of your interventions. This is very important. At the point of care also, it's very important to include some specific interventions in terms of leadership commitment, in terms of baseline assessment, action plan, implementation, involving the different teams, and starting the improvement, and think about the sustainability of your intervention. Because most of the time we do things, but we don't think much about the sustainability. The WHO role in advancing the patient safety agenda, we have the WHO core function in general, and we have 6 core functions. We have the leadership, the setting the norms and standards, the evidence-based policy options, technical support, shaping the research agenda, and monitoring. And for patient safety, in terms of leadership, more work is needed in order to develop more the leadership skills in terms of patient safety at the different levels. The ministerial summits, for example, is an opportunity, is a forum whereby we can harness and strengthen the leadership and the commitment for patient safety. Setting the norms and standards. We have norms and SOPs, intervention and solution that are being developed for patient safety priorities. Evidence-based policy options, or let's say science-based policy options, technical support to countries on how to develop their programs and how to implement the corrective measures, shaping the research agenda, supporting countries on how to develop proposals and how to implement research. And mainly what we need for patient safety is the implementation research, meaning that how can we make things work in different settings and different challenging countries. The monitoring the situation is also very important, and we should have a system that collects data about patient safety priorities and monitor them and address them properly. At the WHO, we have what we call the GPW 13, the General Program of Work 13. And you have the mission of WHO is to promote health, to keep the world safe, and to serve the vulnerable. The strategic priority, universal health coverage, and as we have mentioned, universal health coverage cannot happen without quality and safe healthcare services for different settings, including emergencies, conflicts, and also vulnerable populations such as refugees and migrants. The strategic shifts in terms of, because we have countries with different levels of, capacities. Let's say we have low income, we have middle income, we have high income countries, we have countries that face adversities, fragile and vulnerable, and our support to these countries should be tailored according to these capacities. Some countries will need more support on the policies, and others will need more support on specific priorities, such as, for example, infection control, medication safety, surgical safety, depending on the maturity of their system. The organizational shift will need to have some sort of measuring the impact of what we are doing and focusing mainly on the impact at the country level, reshape the operating model to drive country and regional impacts, and these are key for the general program of work for WHO. The upscaling action, of course, one key principle even before the prioritization is to build on the existing work that relates to patient safety. For countries, for example, that are relatively advanced with patient safety, they should build on the existing achievements or accomplishment in relation to patient safety. Then the prioritization is very important because as I have mentioned, we have 5x7, 35 intervention. You cannot address them all. So you need this prioritization. And the prioritization will need to involve the different stakeholders in order to agree on what comes first. And this is very important. And here, I think the community, the public, and the families and the patients will play a key role for the identification of the priorities. Contextualization, this what works here will not work in another setting. Of course, it needs discussion, it needs some sort of adaptation, and it needs to be fully aligned with the national health priorities, the national health priorities in general. So if your priorities is non-communicable diseases, you need to discuss what in the non-communicable diseases need more, I think, attention in order to improve safety. Leave no one behind, ensuring access to the vulnerable population, because most of the time we focus on and they are not given enough attention, I mean, in terms of refugees, vulnerable migrants, and this is very important. Learning systems is key, because if you have a learning health system, you will be able to gain relevant information and then see to what extent you have improved the situation. Promoting patient community empowerment and accountability is key. In some countries, the problem, despite all the efforts that you have, you implement for improving quality and safety, there is no, you don't see a real progress, and this can be related to the accountability measures. Integration with the health policies and priority programs, because most of the time the patient safety and quality are separated from the other programs, while it should be something embedded in it. Since the design of this program, you need to discuss how to make sure that care will be of quality, it will be effective, it will be safe, and this should be considered from the beginning, because we wait till the end and then we say, no, we are not performing well and the quality is not there, because we didn't pay attention from the beginning on how to make things safe. The COVID-19 pandemic, considering safety as a priority, because as the learned lessons that we deal with things in terms of response only, while we should, it's even a principle of patient safety is the risk management, the preparedness, preparing for pandemic, preparing for disasters, and this should be considered from the preparedness, the response, and even the recovery. The ongoing work in the EMRO region, we have the flagship for patient safety in EMRO is the Patient Safety Friendly Hospital Framework. It's a set of evidence-based standards that we include most of the programs on the intervention that have been developed by WHO. For example, in WHO, we have the clean care, safer care, we have the safe surgery, we have the community engagement, we have the safe medication, we have many things, the curriculum, the training, the leadership, and all these elements are integrated in this, I can qualify it as a platform. It's a platform that integrates the different, because as you know, in quality and patient safety, you need to have a bundle of intervention in order to succeed your program. You need to have the leadership, you need to have the technical, you need to have the evidence, you need to have the training, all these things together in order to succeed the implementation. And this is why we have compiled everything through this framework, which is the Patient Safety Friendly Hospital Initiative. And many countries in the region are adopting this framework as a flagship for their patient safety program. We have this for hospitals, and we have the same for primary care as well. We have also documented the role of primary care, because as you know, the primary care was not really fully involved in the fight against the pandemic. So while the primary care could be of great help in terms of ensuring essential health services and even promoting community engagement information, and so we have this technical paper as well. We have developed modules for patient safety on primary care. We have also we are including patient safety during COVID as part of the modules in the patient safety curriculum. We have also developed a set of indicators for health workers' safety that has been implemented in 4 countries, namely Saudi Arabia, Oman, Iran, and Jordan and Palestine, 5 countries. These are different tools that we have developed for patient safety. We have the assessment manual, the second edition, a toolkit on how to implement corrective measures at the operational level. We have also advocacy and awareness tools for those who are willing to develop patient safety programs. And we have many other tools that we have developed. And here I need to mention the quality and patient safety framework in fragile, conflict-affected, and vulnerable settings. And this is a framework that we are using for countries that face adversity, such as Afghanistan, Somalia, and Yemen, others, whereby we have an approach that takes 2 levels: the central level in terms of what are the priorities, what are the coordinating mechanisms, the measurement, and the accountability. And at the ground level, we have the tools. We start with the most critical ones, and then we will try to build the quality and safety improvement program. So the take-home messages are heavy. We have a heavy burden of unsafe care that is avoidable with good returns. Patient safety is critical to achieving universal health coverage. It's the foundation for health systems strengthening and health systems resilience. Member states have committed to invest in patient safety. WHO Global Patient Safety Action Plan provides the pathway to enhance member states' capacities to ensure safe care, and support to countries should be tailored according to local context and capacities and priorities. I will stop here, and thank you for your attention, and be happy to answer if you have any questions. Thank you.
Thank you. The next presentation will be from Helen Haskell. She is from the organization Mothers Against Medical Error and Consumer Advancing Patient Safety. Helen Haskell is a president, as I mentioned, of Mothers Against Medical Error, a South Carolina-based group dedicated to improving patient safety and providing support for patients who have experienced medical injury. For Helen, patient safety is a calling to which she was brought by the death of her 15-year-old son, Lewis, who died in the hospital following routine surgery. Following Lewis' death, Helen helped create a coalition of South Carolina health professionals and consumers to pass the Levy's Blackman Act, aimed at addressing the conditions that led to Levy's death. Helen is a World Health Organization patient safety champion and has served on patient safety advisory panels for a number of national organizations. Please make now video and we will, Medication safety, a global
Helen
problem.
Haskell, patient safety advocate from the U.S. I'm the former co-chair of the WHO Patients for Patient Safety Advisory Group and of the Patients and Public Working Group of the Global Patient Safety Challenge, Medication Without Harm. WHO has taken on medication safety as its patient safety theme for the year. So I'm going to follow up on that theme by talking a little bit about medication safety from the perspective of the patient. I'll start with a story. This smiling young man is Louis, a healthy teenage boy who went into an American hospital for elective surgery. 3 days after surgery, Louis developed excruciating abdominal pain. Nurses and junior doctors thought it was a relatively minor effect of the opioid drugs he was being given and did nothing. A day later, Louis died. The cause of death turned out to be a perforated intestinal ulcer, a known and feared side effect of the other pain medication he was taking, the NSAID painkiller ketorolac. As you may have surmised, Louis was my son. He was only 15, but he was a brilliant scholar, writer, athlete, musician. He was the sun and moon to us, and his losses guided all my subsequent actions. He died in large part because the people taking care of him were not familiar with the side effects of the drugs they were using. This is the reason for my interest in medication safety. Louis was one little boy in one country in the world. What does this translate into in the big picture? Well, globally, harm from medical care in general is a leading cause of death and disability. It exceeds lack of access and in some countries even exceeds the burden of common diseases like tuberculosis and malaria. A recent review has estimated that half of all preventable medical harm is due to medication. Severe medication side effects, adverse drug events, are a leading cause of hospital admissions and a leading cause of patient harm while in the hospital. And outside the hospital, incorrect prescriptions and overuse of medications are extremely common. In my years as a patient advocate, I've talked to many healthcare providers and interviewed and surveyed many patients who have suffered medical harm. What I take away from these interactions is that some of our biggest problems revolve around misperceptions of the safety of medications. Both patients and providers overestimate the benefit and underestimate the risk of medications. In general, they fail to respect the power of medications. Many, if not most patients, assume that every prescription is carefully thought out and every drug is safe, and they would not dream of questioning it. Our solutions are really sort of simple, at least on the surface. Information, communication, and transparency. Shared decision-making is a detailed conversation outlining both risk and benefits. Providers who do this often find that patients are more risk-averse than they expect. The medication process also needs to be demystified. People may not be medical experts, but they can be motivated to understand a lot when the topic is their own health. They need to have meaningful interactions with healthcare providers in a way that personalizes and explains the medication process. Drug reactions are the root cause of many serious medical errors. I just want to give you an idea of how this may happen because it's usually far from straightforward. Here are some of the common threads in the cases I've looked at. Misdiagnosis, as in Lewis's case. This is a broad swath of the landscape. Healthcare providers are trained to look for disease. Often they don't consider the possibility that a patient's symptoms could be drug-induced. A treatable or temporary medication effect may be mistaken for a serious medical condition, leading to risky and occasionally deadly interventions. The original adverse drug event is often forgotten in the context of all the medical events that come after it. Investigations aren't always in-depth enough to find the cause, and prescribers may fear liability or even the burden of guilt, and don't always have the will to look too closely. The result is that families are often the engine behind determining what happened. The power of families to bring about change should never be underestimated. As an example, in Lewis's case, the possibility of drug reaction was not mentioned on the death certificate or anywhere in his records as a possible cause of harm. His case summary perpetuated an early erroneous theory of the medical trainees that his deterioration was due to high potassium. No one reported the death to the manufacturer or the FDA but us. As a drug-related death, it was invisible. Now I want to talk a little bit about polypharmacy. The term is usually taken to mean taking 5 or more drugs on a regular basis. But of course, some people need to take that many drugs. In that case, polypharmacy is considered appropriate. Our concern lies with people taking multiple drugs that are not helping them and may cause harm, either separately or in combination. This often occurs because of drugs being prescribed by multiple providers, or drugs that are not discontinued when they should be, or from patients self-medicating on top of prescription medication. Polypharmacy is a global issue, even in lower and middle income countries, and across the globe, most unnecessary polypharmacy and most preventable adverse drug events occur in older people. Here's a further twist on the problem. A recent study from Canada showed a rate of emergency department visits for drug reactions that was about average for a high-income country, 1 in 11 patients. But nearly 1/3 of those patients were there because they had been re-prescribed a drug or drug class for which they had previously visited the same emergency department. Another recent article from Australia warned of a different version of this phenomenon. Patients in the hospital for a drug reaction were automatically re-prescribed the same drug at discharge because it was in their records. Incidents like these speak volumes about the fragmentation of our healthcare system. The Canadian authors also noted that adverse events from re-prescribing were 100 times more common than system errors, like errors in administering or dispensing drugs. Even though system error is where most of our efforts in drug safety have been focused. I see the same thing in patient surveys. Patients attribute the vast majority of medication harm to prescriber error. They very seldom report an adverse event due to system error. So, what do patients need to help them manage their medications safely? Well, medication review is a cornerstone of medication safety. It means going over all your medications with a knowledgeable medical professional to be sure that they are all needed and beneficial and that it's possible for you to take them as prescribed. This should happen at every transition of care, and it should include the patient and family, especially at hospital discharge. But even in high-income countries, this seldom occurs, even though we have the ability to do it. In addition, people need access to information on risk and side effects. They need to know what a dangerous reaction might look like and how to report an adverse event to their provider or to the authorities. Here are a few places where you can get tools to help with some of this. One is the World Health Organization Medication Without Harm website. The Medication Safety Challenge materials include 3 technical reports shown on the left, which are concise, readable, and informative on some of the major issues. On the right, you see 5 moments for medication safety, a patient resource with questions to ask at various steps along the medication journey, and an electronic app version that also functions as a medication list. To access these free materials, you can just type WHO Medication Without Harm into your search engine. The Eye Sympathy Project in EU is run by a group of pharmacists from Ireland, Northern Ireland, and Scotland. They have incredibly detailed resources for both patients and providers. Their focus is on polypharmacy and medication review, and they link to a veritable goldmine of resources from the Scottish Government, with safety information on specific drugs, medication passports, risk assessment tools, much more. Another very thorough website, not pictured here, is the Institute for Safe Medication Practices, ISMP, in the U.S., which has a consumer website as well called Consumer Med Safety. And lastly, you've heard me talk about reporting adverse events. Many countries take reports from consumers as well as healthcare professionals, and in many countries, consumer reporting has overtaken reporting by professionals, which I think will give us a much more robust picture of medication performance in the future. A number of low and middle income countries subscribe to a smartphone app called Med Safety, which is supported by WHO and the Uppsala Monitoring Center in Sweden, which handles global monitoring for WHO. The materials you see on the screen here are consumer materials from Uppsala, mostly created for Med Safety Week, which just happens to be coming right up in about 3 weeks. So, in honor of Med Safety Week, I'm going to end by playing you one of their spots. Please report your side effects. Here's my contact information if I can be of any help to anyone. Thank you very much for your attention.
Thank you very much, Helen. We miss you here, but we know you couldn't come and be with us in person. The third presentation will be from Sue Sheridan. It will be patient and family engagement. Sue, as I mentioned yesterday, has a special place in my heart and in the heart of many, many patients and people who knows what is patient safety. She was the first woman who informed me what is this and what we can do as people. But some information about Susan Sheridan. She is a founding member of Patient for Patient Safety US and currently serves as the Director of Patient Engagement Emeritus for the Society to Improve Diagnosis in Medicine and advisor to World Health Organization. Prior to her work at Society, Sue served as patient and family engagement advisor at the Centers of Medicare and Medicaid Services. She also served as a director of patient engagement for Patient-Centered Outcomes Research Institute and led the Patient for Patient Safety program at the World Health Organization. Prior to her leadership in patient engagement, she just worked as a finance banker, so she changed totally her life. Please, the floor is yours. We invite Susan.
Thank you, Jolanta, and good morning. So yesterday we were talking about the new normal. And so what I'm going to talk to you this morning is about the new normal where patients and family members, civil society, patient organizations are partners in driving safer care. And I want to say something a little bit about patient safety. Yesterday I was having lunch and I think it was Joe. Joe, I don't know if you're in the room. And Joe said to me, well, what is patient safety? And so I just want to clarify that patient safety is when patients experience adverse events or harm that's unexpected during care delivery. So it can range from, like when Helen was talking about, medication safety. It can be a delayed diagnosis in breast cancer, as we heard about yesterday. It can be the wrong patient, wrong surgery. It can be the omission of tests that could be life-saving. So there's a variety of different events that we could call patient safety. Many of you are with disease groups, And while you're managing your disease and your frequent flyers in the healthcare system, you can experience harms just during managing your disease. So I just kind of wanted to establish that. I also want to talk about the new we. We as patients, we as hospital administrators, we as nurses, going forward, we have to think about this new we, because it is going to take all of us to create a safer healthcare system. So what brings me here today? Much like Helen, I'm talking about patient safety because in my family, we experienced 2 patient safety events. One to my son, Cal. When he was born, he suffered brain damage when he was 5 days old because of his newborn jaundice. It was completely preventable. And because I didn't administer a $1 test to test his bilirubin levels, today Cal's 27 and has cerebral palsy, hearing impaired, speech impaired, mobility impaired. 4 years after Cal, my husband Pat had a tumor in his neck that was taken out successfully. The pathology was malignant, but that pathology got lost in the healthcare system, never communicated to my husband or his doctor or to me, and it ended up penetrating his spinal column, and he died when he was 45, when Cal was 6, and during that time, we had a daughter, Mackenzie, she was 4. So patient safety is seared in my soul, and I started getting more engaged in talking about it, and that's what ended me up at WHO, leading Patients for Patient Safety. So I'm actually wearing many hats today. I'm wearing the hat of a mom, I'm wearing a hat of a widow, but I also, during my journey, I was at WHO for 7 years leading Patients for Patient Safety. I also became a federal employee of the US government in healthcare in the United States, so I worked in the system for a while. So I worked with policymakers and researchers. So I wear all these hats as I speak to you today. Next slide, please. Oh, that's me. So I just want to tell you a little bit about Patients for Patient Safety US. It is about 1.5 years old. It falls under the umbrella of WHO's Patients for Patient Safety program. And we formed, you can see the middle, and Mandir spoke about this, to implement the mission of the Global Patient Safety Action Plan. So our goal in the United States is to implement, Mandir showed you that 7x5 or that 5x7 matrix. So we are dedicated to implementing that. Now, the majority of our implementation of that plan, you can see that middle blue with that arrow pointing over to patient and family engagement. As Mandir said, patient and family engagement is one of 7 strategic objectives. Now, this is a loud and clear message from WHO and from the World Health Assembly that they are relying on us, patients, family members, patient and civil society organizations, to play a crucial role in not only implementing the Global Patient Safety Action Plan, but at driving change in our respective countries. So within the patient family engagement section, and I have to share, the Global Patient Safety Action Plan is a very comprehensive document. It's quite long. You want to get a cup of tea or a glass of wine or something and sit and read through it all, but it's very well done, very comprehensive. And I'll call this our section. In the patient family engagement section, WHO says patient engagement empowerment is perhaps the most powerful tools to improve patient safety. Now let that sink in. This is the WHO saying that we might be the most powerful tool to improve safety. I thought that was quite bold of WHO, and of course we all appreciate that. So when we talk about patient safety and patient family engagement in patient safety, here's the definition that will be coming out shortly in a new patient family engagement framework from the WHO. But quite simply, patient family engagement in patient safety is the active participation of patients and family members, and that also means patient and civil society organizations, with all stakeholders, that's the new we, to achieve the maximum reduction of avoidable harm from unsafe care. So remember that. Okay, now this is kind of dense, but this is our strategic objective number 4 that I've been asked to talk about. There are 5 strategies within this objective for us to all get to know and learn. I'm not going to read all of that, but number 4.1 engages in all decision making. Bring us to the table when we're creating policies, programs, guidelines, strategies. 4.2 in the middle, learn from experience of patients. We are data. We are teachers. We want the healthcare system to learn from us. 4.3 is build the capacity of patient advocates. Build us up, give us the skills, and unleash us to be effective change makers in the world. And Yolanta, maybe during Q&A, you could ask me about capacity building, because there's a lot more to say about that. 4.4, establish the principle practice of openness and transparency. This is more about establishing truth-telling, so that patients understand when things go wrong, we're told when things go wrong, transparency to our own patient data. And so that's another strategy. And the last one is empower us with knowledge. And we talked a lot about educating patients and everything yesterday. Provide information to us to empower us, to keep us and our family members safe. So I'm going to talk about two domains of patient-family engagement and patient safety that really is relevant for this group. I'm going to talk about the co-development of patient safety improvement efforts with hospitals, with governments, with professional educators, with funders. And then I'm also going to talk about in advocacy and awareness raising that, again, I give my hats off to WHO for having the courage of elevating how important advocacy and awareness raising is. Yesterday we spoke about how to meet patient expectations. And honestly, the only way to meet patient expectations is to work with patients and learn what our expectations are. And so this is one domain, this is the actions for co-development of patient safety improvement efforts. Now, in the Global Patient Safety Action Plan, under patient-family engagement, there are 76 actions for us. So I'm not going to go through all 76, but I'm going to talk about some that speak to us right now. One of the actions that the WHO is calling on us is to join our governments, join our healthcare leaders, and create patient safety rights charters in our own country. Italy, I think maybe you're talking about doing that. We're bringing this up in the United States. I think we all deserve to have, patient safety as a right and to have a charter that spells that out. The next is community oversight mechanisms for local healthcare system. The WHO is calling on us to partner with our local authorities to create oversight of the mechanisms. Okay, the next is mechanisms to learn from experience of patient and families. We have so much knowledge, and like I said, we are data. We are information for the healthcare systems to improve, but we're not collecting the information from us in a way that systems can learn. And so we can help healthcare systems and our government create surveys, and we can create storytelling opportunities where patients could tell their stories in events to move the hearts and minds to change things. We can have listening sessions so that patients can tell their stories, healthcare workers can tell their stories. The next is patient and family advisory councils that patients can help co-develop. This has been a very effective tool, especially in the United States, probably other countries. I know Singapore also has very effective patient and family advisory councils in their healthcare systems, where the healthcare system will recruit patients and families, some who have experienced bad outcomes, and they will help shape strategy for that healthcare system. The next is patient education and information. We talked a lot about that yesterday, but how can we, as patient organizations and civil society, create information that's meaningful to us, that we understand, that is feasible? So much information for patients is created by maybe healthcare professionals, where in their mind, that's what we need to know, but actually that's not what we understand. So it's so important that we, as patients, families, patient organizations, help create that patient education that is feasible, understandable, and trustworthy. And the last is that patients and family members and civil society can help co-create policies on disclosure. So disclosures, when things go wrong, how are we told? We need policies about that. Transparency and patient access to medical records. I don't know about your countries, but in the United States, we just implemented a new rule giving us access to our own medical records. And this is important for patient safety because we can be those extra eyes on our own medical records and find errors or documentation errors or medication errors. So this is an area where we could all work together on co-creation. I want to point out something else. In the Global Patient Safety Action Plan, WHO wrote in here that it is imperative to acknowledge that developing patient safety solutions must not only rely on scientific and technical expertise alone, but must also involve advocacy, awareness raising, political commitment, persuasion, and localism. And this is speaking to us. So here are some opportunities just around, again, I had to pick just a few because there's many, many actions proposed, but to actions for advocacy and awareness raising. What can we do? We can raise awareness about patient safety. This is something that we can all do through our organizations, through our storytelling, in our community forums. We can develop and disseminate patient education materials, just like we have mentioned over the days. We can advocate at our governments, at our healthcare systems, at our professional organizations, the full inclusion of patients and families in all patient safety planning and programming. We can recruit, build capacity, and mobilize patient advocates. We can organize national events just like this to share the experiences and expectations around patient safety. And we can identify and advocate for new patient safety funding, policies, and legislation. So what steps can we take to achieve the actions of the Global Patient Safety Action Plan? Number one, we can tribe up. Now, this is a saying in the United States, as we all work together and we unite with others with the same values as we call that tribing up. So I'm calling for all of us to tribe up, work together. I think something that has happened in the world, and one reason why patient safety, while we're still unsafe in our healthcare system, is that we've worked in a fractured way. We as patients and families have been divided and fractured. And I think there's an opportunity, Yolanta, I want to join the World Patient Alliance in some way so we can all start working in a cohesive way and driving change together. The next is commit. Commit to positive activism that uses the energy of difference to inspire and change. Sometimes the term activism is a negative term, but we believe that it can be a positive term. Again, activism that uses the energy of difference to inspire and change. Build capacity. This is so important that we need to develop, we need to learn how to communicate with policymakers, with doctors, with nurses, with leaders. And we need to learn how to tell our stories. We need to have negotiation skills. But on the flip side, I have to admit that there needs to be capacity building for our policy makers, for our healthcare workers, for our hospital leaders on compassionate listening, on cultural competency, on trust building skills. So I think this capacity building is a real strong area. We need to learn how to develop our ask and be specific. Now, when I worked in the policy making world, it was so often that patients came to us, their ask was scattered, it was asking for too many things. We could never really drill down to what the patient and family really wanted. So develop your ask, be specific, be focused, and be evidence-based when you can be. The next one is be visible. Blog, tweet, publish, write, offer interviews to the media, present, become influencers. We can't sit back and wait for people to come to us. We have to be out there, reaching out constantly, making people aware of who you are and how we together as partners are trying to drive patient safety. And then finally, participate in public forums, webinars, events like this. Offer public comment and submit questions. Many governments, I don't know, for all the countries, but have opportunities for, public comment, go there, go to those microphones, submit questions. So finally, I think what we need to talk about is a revolution of hope and not despair. Yes, times are hard. Yes, it's a very complex world, but I think we have to all agree to remain focused on hope and not despair. And so remembering those last words, or those words from the WHO, that perhaps we are the most important tool and most powerful tool to improve patient safety, let's embrace that invitation from the WHO. Let's tribe up and work together to achieve the goals in the Global Patient Safety Action Plan so that all involved in healthcare are as safe as possible as soon as possible. Thank you.
Thank you very much to Susan. And our next speaker will be Karsten Engel from International Society of Quality in Healthcare. I will be very short in presenting now next speakers because we are short with time. So please join us online, Karsten. Yes. He's not there.
Thank you for the opportunity
Yeah.
to share some thoughts on the importance of patient engagement. There is no doubt that patient safety is under pressure. I'll show you just one example. In a recent paper, the authors reported substantial deterioration in the US on multiple patient safety metrics since the beginning of the COVID-19 pandemic. They found an increase of harm that is known to be avoidable, not only in theory, but also from solid and well-documented practice. Pursuing patient safety forward is complicated by issues in the context of healthcare that are becoming more and more obvious to everyone. These are just a few of them. Workforce is increasingly hard to recruit and retain. Resources are limited even in the richest countries, while expectations are not. So, what can we do? We can't meet challenges by doing more of the same. There is a need for transformation. Every system is, as you know, perfectly designed to deliver the result it does. The transformation must be based on an understanding of how healthcare works. Two important concepts to understand are co-production and complexity. When you manufacture a product, you control the process and finalize the product that is then used by someone else at some other time and place. The quality of the product can often be assessed objectively and independent of both producer and user. In contrast, a service is produced by an interaction between the provider and the service user in the moment where it is delivered, and quality is determined by the experience of the involved persons. Add to this that healthcare is a complex system. While you can facilitate its performance by defining and standardizing processes, you can't control it entirely. Realizing this will make you realize the importance of what is going on at the moment when persons meet to co-produce services. Establishing a partnership here will promote quality, as will establishing a partnership when the system is designed and monitored. This was acknowledged by the group of authors from the Lucien Lieb Institute when they identified 5 overarching transforming concepts that would promote patient safety. The paper was published in 2018, but the list is still valid. I won't read the list out to you, but you can see they confirm the importance of partnering with patients and families. Let us explore what that might mean. The patient is the only one that experiences the entire journey. This is particularly true for chronic conditions and when several providers, hospitals, primary care physicians, home-based nursing care, families, and the patient themselves all contribute to care delivery as co-producers. Safety is not a constant attribute of a system, but something that varies over time at different places and in different cases. In this slide, you can see how safety varies along 4 patient journeys: arthritis, hip fracture, diabetes, and depression. I won't go into the details about what the stories might be and why safety fluctuates as it does. I'm sure you can imagine such stories. But now I tell you that this was not about 4 different persons. It was one person with 4 conditions. Put the curves on top of each other, and I'm sure you grasp that there might be causal connections. But would they be obvious to a diabetes team monitoring the safety of diabetes care? Patients are not just passive recipients of care. Sometimes they act by themselves, they reach in. This can help mitigate errors and weaknesses in the healthcare system scaffolded. The core components of resilience, the ability to perform as expected under conditions that may vary both in known and in unexpected ways, are anticipate, monitor, respond, learn. When patients meet the healthcare system, they do the same. Sometimes they save the day, for instance, by asking for an expected test result that they have not been informed of and that turns out to have been lost. Most of the time, their anticipate, monitor, respond, learn is independent of the systems, and the system might never know of it. Isn't that a waste? Patients should be partners with whom professionals co-produce care and with whom professionals share decision-making power. As a partner, you must be prepared to take your share of responsibility. This is true when it comes to decisions about your own care. It's also true when it comes to redesigning healthcare, including deciding how to make the most of limited resources. To achieve this, we need to ask you the core question of person-centered care. What matters to you? Thank you.
Thank you very much, Carsten. The next speaker and our last speaker in this session is Regina Namata-Kamoga. Regina is running a chain community health and information network, and she is also a board member of World Patient Alliance. Hello, Regina. We miss you all here, but you have some people also from your continent. So please go away and check the minutes because we need to finish on time. Patient and community engagement in patient safety. Regina Namata-Kamoga, the floor is yours.
It's a pleasure being here today. My name is Regina Mariam Namata-Kamoga, the Executive Director for Community Health and Information Network, and also board member of the World Patient Alliance. Today I'm going to be talking about patient and community engagement in patient safety. I'd like to tell you about Community Health and Information Network. It's an organization that promotes the empowerment of people living with and affected by HIV and AIDS, TB, malaria, and non-communicable diseases. We also offer capacity building to community-based organizations. We support orphans and vulnerable children and their guardians, youth, women, most at-risk populations, and other vulnerable populations in the community. CHAIN also promotes health literacy and patient safety. CHAIN is also the Secretariat of the Uganda Alliance of Patient Organizations. This is an alliance that brings together patients across all disease areas in Uganda. It's always a pleasure to talk about patient safety, not only because it's personal, but I know that each one of us is affected by patient safety in their different ways. On a day-to-day basis, many people are harmed, they're disabled, and some even die due to unsafe care. And what is also very sad is that most of these incidents are very, very preventable. In low and middle income countries, 134 million adverse events occur per year due to unsafe care, leading to 2.6 million deaths annually. In the developed world, 1 in 10 patients are harmed while receiving hospital care. Like I said again, most of these are very, very preventable. And when it comes to Africa, the situation is even worse, why it is 20 times higher probability of being harmed. And there's no data on this, but we know that the situation is made worse due to issues at the systems and the patient level. System-based challenges include insufficient data on patient safety problems, the weak safety and quality culture, supply chain challenges, reporting culture, policy challenges, inadequate human resource capacity, ill-trained and unqualified healthcare professionals. We have so many mushrooming medical trainings which churn out very inadequate healthcare professionals. The issue of paternalism, where the doctor knows it best. This presents a big issue because patients cannot air out their needs and their views, while the doctor is looked at the only person who knows it best, and therefore the patient have no voice in all this. So there's a lack of a strong patient voice, plus the paternalism. This again impacts patient safety. Patient-based challenges are a result basically of patient vulnerabilities. We know that patients in Africa are vulnerable due to the double burden of communicable and non-communicable diseases. They have poor access to healthcare, low literacy, health literacy levels, poverty, stigma and discrimination. And these vulnerabilities lead to late diagnosis and other unsafe use of their medications, like self-medication, exposure to substandard and counterfeit medicines, and many times seeking alternative care from traditional practitioners. There are quite a number of stories of unsafe care in Africa, and particularly Uganda, starting from at a personal level. I've been impacted, and my experience and my passion for patient safety actually stems from these experiences that I've had at the personal level, at family level, with a near-miss incident when I was having my first child, at the community level, where I've witnessed patients being harmed and disabled or even losing their lives. My mother almost died due to an overdose of her hypertension drug and was only saved by my young nephew, who had health literacy training and was able to save her life. So in 2011, when I joined the first Africa Patient for Patient Safety workshop, I then realized that patient safety was not only a personal problem, but very many people from different parts of Africa and the world as a whole had actually interfaced with many problems on patient safety, and therefore it was not only a Ugandan or regional issue, but a global issue. And that marked the beginning of my long journey towards patient safety advocacy. A journey, I must say, that hasn't been easy due to many challenges. There's also another story in Uganda of a 3-year-old girl who had malaria and cough and was taken to a private clinic and given an IV for the treatment. She developed gangrene, a condition where blood flows to the tissue, is cut off, causing the tissue to die. This young little girl had her arm amputated. Based on the issues that we have seen at the community level and other experiences, Chain proposes to address the problem of unsafe care, providing both patient and community level, as well as systems-based solutions. At the patient and community level, we have engaged patient, family, and community. And at systems-based solutions level, we have been involved in policy advocacy and system strengthening interventions. The power of patient, family, and community engagement cannot be overemphasized. And at Chain, we believe that patients, family, and community are very critical in this process because for so many reasons. First of all, patients are the only constant in the whole process of receiving care. And it's important that their role is recognized We know that the patients best know their needs, and most of all, when things go wrong, they're the ones who suffer harm. So Chain has emphasized this, and have engaged and empowered patients. We provide information and tools to enable them make informed decisions while navigating the healthcare delivery system. We know that when patients are empowered, they are better able to engage at an equal level, they are better able to demand for quality, but because they see things that busy health workers can't see, they are better able to even support the health workers through this process to ensure that the harm is reduced. So Chain has spearheaded the formation of patient-based advocacy groups to raise the patient voice at the different levels. And as a result, a number of patient advocates, members of the Uganda Alliance of Patient Organizations, sit on different technical working groups at the Ministry of Health to ensure that patient safety is integrated in all these processes. And for our patient and community engagement, we have developed a patient-rich methodology. And this methodology is basically looking at the different resources involving the different healthcare stakeholders through the community-based groups, through the academy, through our data hub where we collect data and information. And in all this process, it emphasizes listening, assessing, empowering, and referring patients, and as well as follow up to the different partners that we work through. We do different interventions, school outreaches, community outreaches, media engagement, and particularly the World Patient Safety Day, where we bring together all the different healthcare stakeholders and patient organizations and the community at large to brainstorm, and through music, dance, and drama, through tailored interventions to ensure that we reach the unreached in the community. One key case study is the World Patient Safety Day. This year alone, we have been commemorating World Patient Safety Day since 2019, and through different activity, and we've impacted very many people. But particularly for this year, Chain has reached 3,682 beneficiaries, and through our Start Early in Life initiative, who are all involved in commemorating World Patient Safety Day, we engaged and impacted 1,592 children, as well as 237 guardians and teachers, again through research on medication safety and through music, dance, and drama, where children were able to. Commemoration of World Patient Safety Day has been a major part of our patient safety activities in the community. In this picture, we had a drama session on medication safety for children in our Start Early initiative, as well as marching. We also provide prevention, treatment, and care services, and with a major focus on the theme of the year. And here it was medication safety. So in all the sessions, medication safety was emphasized. We also engage community health workers. These are the first point of contact in the community. So their empowerment and knowledge on medication safety issues is very important. So we engage them again through different ways, through drama, debates. Here we had a debate where the community health workers were competing with community health workers from another region on the issue of medication safety. It's a very good way of imparting the knowledge, and also it has a very big multiplier effect, since these are the community doctors, so to say. At the systems-based level, Chain has done a lot of advocacy, and especially bring awareness about the patient needs and perspectives, and this is through partnerships and collaborations with private and public sector, supply chain organizations, regulatory authorities, Ministry of Health, and WHO and other institutions. Here it's important that the needs of the patients are brought to the policy table, and like I said, through the different technical working groups where our members of the Uganda Alliance Patient Organization sits, they're able to bring these needs, and indeed very evident results have come out of this. We do patient safety trainings for medical personnel and community health workers in private and public sector facilities, raise awareness on patient rights charter, and make input to different guidelines and strategies by the partners and Ministry of Health, as well as community research and data management.
Thank you very much, Regina. It was a wonderful session.
And medication safety projects. We've worked with partners in research institutions to mobilize and empower communities to ensure that patients can report. Traditionally, it's been the doctors that have been reporting the adverse events for the patients, but it yielded very limited results. And increasingly, it's recognized that when patients report, there are more reports, and the key stakeholders are able to identify these at a very early stage. So Chain has been involved in a number of interventions, working with IDI, National Drug Authority, and Makerere School of Public Health to ensure that patients are engaged and involved in reporting their side effects on the drugs that they're taking. Engaging with Ministry of Health has also been a major part of our work, especially in promoting medication safety. And this year, Chain was at the height of organizing the World Patient Safety Day, working with the ministry and ensuring that we raise awareness at the national level through different activities that were conducted by the Ministry of Health and other partners. Chain works in partnerships with many organizations, including Ministry of Health, World Health Organization, health service providers and universities, IDI, National Drug Authority, lower health facilities at the community level, Nottingham Trent University in UK, My Climate, the Uganda Alliance of Patient Organizations, the World Patient Alliance, the Center for Human Rights and Development, CEHAD, Pfizer, Medical Access Uganda. We recommend the following, especially in terms of addressing unsafe care. It's important that we sustain our advocacy for patient safety and become a voice to the voiceless. Culture of safety is also very critical, ensuring that the patient is at the center and she's not just a passive receiver of care. The issue of building and strengthening networks on patient safety chain has been very key in terms of ensuring that we build these networks not only at the national level but also regionally and also internationally, and has supported very many organizations to start up patient safety initiatives in their own countries. Frequent communication and open discussion between healthcare professionals and patients to improve the doctor-patient relationship, because it also very much impacts patient safety. The need for continuous patient and family engagement and empowerment to create a critical mass of community patient safety advocates. A key message for us today, which I want you to take home, is that we need to start these interventions very early in life, and that's why at Chain we involve the children, because they're very, very good ambassadors, and when they get these practices, they're better able to adapt to them, and they have a bigger multiplier effect. So start patient safety interventions and in life is the key message for today. Thank you very much for listening.
Thank you. Thank you to our speakers, and I know you have a lot of questions, but because we have a limited time and next session will start soon, so maybe during the break after the next session or during lunch, we have our Sue, we have Monty, so we can talk to them and ask questions. One announcement. Every participant, every speaker will receive the certificate of attendance, and we send it by email, so don't worry, everybody will receive it on time after the conference. And one thing more, I will invite Mike Obara. He will be a moderator for the next session. Is he on here? Yeah. Thank you. I please come also here, Paul Barach, Anna Śliwińska, Risto Mietunen, and Anna Eliza Barbar. They will be our speaker for the session Healthcare Emergencies. I hope you enjoy this next session, and you also have a break after the session. Yeah?